Hi, I'm Danika Koopmans.
And I'm Sharon Hughes-Geekie. We're your hosts of Docs of Vernon. This is an interview and podcast series designed to help you navigate the healthcare system and get to know the physicians that provide your care.
Topics include what the heck is a hospitalist, treating addictions, and alternatives to going to the ER, plus so many more.
This is your link to healthcare in your community. Welcome to Docs of Vernon. I'm Sharon Hughes-Geekie. Today I have the pleasure of interviewing my co-host, Danika Koopmans. Danika is a nurse practitioner at Vernon Jubilee Hospital, and she is also the owner of Sanctuary Botox, a beautiful clinic that she operates out of her home. Welcome, Danika.
Hi, thank you so much. It feels weird to be on this end of things. A little nervous.
It does. It feels weird to be interviewing you. Now, there are three types of nurses. There's the licensed practical nurse, there's the registered nurse, and there's the nurse practitioner, which is the highest level of nursing, which is what you are. Can you briefly tell us what the difference is and what your scope of practice is that differs from the others?
Yeah, that's a great question. I think it can be really confusing, especially because you see nurses working in all facets of medicine. You don't just see them in the clinic or in the hospital. So an LPN is 2 years of nursing. A registered nurse is 4 years, and you get a Bachelor of Science in Nursing. And then to become a nurse practitioner, you actually have to do sort of like what I would call a residency in nursing. So you actually have to work for 2 years before you're even eligible for applying to the program. So any NP that you meet is probably going to be over the age of 26, because by the time you've done all that schooling, that's how old you are. You do that, and then a lot of nurse practitioners will take extra courses and skills in that 2 years, knowing that they're preparing to apply to the NP program. Once in the NP program, you can do it straight for 2 years, or you can do it part-time for 3 or 4 years. Most end up doing it 3 years because they already have a career and they're working and they're juggling families and all the things. It's 2 years. In that time, you're working with physicians and specialists, and you're learning from them. You're also learning from your teachers and professors who all have a doctorate in of academics, but they need to usually be a nurse practitioner to teach. So it'll be a doctor of nursing, basically.
So how does your work differ from, let's say, an RN or an LPN? What kind of scope of practice are you using?
That's a great question. I think one of the things I like to tell people about my role when they say, oh, what's the difference when you were an RN? What were you doing? And I say, it's a different job. You know, when I'm working at the hospital, I'm prescribing, I'm managing my own patients, I'm working physician, like I talk to my physician colleagues about best management if I have a question or a concern. We're passing patients back and forth if we need to. Really, who's most appropriate if you're going to be in hospital for a long time and you want that sort of continuity and it's a really complex patient. Usually the nurse practitioner works really well in that department because we often get a bit more time with the patient. Plus, we see our patients consistently throughout the months. We also have the ability with allied health to really work intertwined with some of these patients. And so people don't have to come to us and re-explain the situation. We already know the patient. We can move along quickly for discharge and things like that.
I think yesterday we talked about this. Think Virgin River. Like if you figure out what the scope of practice is of a nurse practitioner, that gives you a good understanding of the difference between an LPN who, you know, is there to support and an RN who administers medications and things like that, and the nurse practitioner who kind of does it all.
Yes, that is the thing. There really is no limit to our scope of practice anymore. There was a time where we were limited. There were certain medications we couldn't prescribe and different things like that. But the reality is when especially when we're working in primary care, we are working independently. So we could be your provider, ensuring that you get the right specialist involved if needed, ordering the right lab work or imaging that's needed, looking at different avenues for investigations outside of all of that. We can manage your care fully. And if we feel we can't, we just talk to the specialist.
Now, when you're not at the hospital, you are operating the Sanctuary Botox clinic. Most people think of Botox as being an aesthetic treatment. Can you tell us the medicinal benefits of Botox?
Yeah, so it's really exciting, actually. I think I was very reluctant to get into Botox. And as I've learned more about it and did extensive training on it, we learned how to do, my husband and I both trained to do therapeutic. And so we treat for migraines, myofascial pain, TMJ, and I get so many patients that come who are suffering. Like, if anybody has ever had a migraine in their life, these people are having more than 15 per month. They can't work, they cannot function. It has completely destroyed their life. And Botox is essentially the last resort. And so when I'm doing therapeutic treatments, we use the preempt study, and it's a protocol that's been put in place for how many units to use therapeutically, which places you actually put the injections and the Botox. And it's incredible the results we are getting. I have to say, sometimes in medicine, I feel like I can't help people. I'm like, this is as far as we can go. And when people come for their migraine treatment, and I see them in their 2-week follow-up, and they're like, I haven't had even an inkling of a headache in 2 weeks. I'm like it brings me to tears, and that is where medicine, it's like, oh, we're actually healing here.
That's wonderful. What can you tell us a greatest success story that you've had with Botox?
I have to say, honestly, like, anecdotally for my practice, don't take this as like a data, but 95, 99, I've only had one person who hasn't actually had complete or 60% relief of their migraine. So what I mean by that is either they have no migraine for the duration of treatment, which it's 3 months that the Botox actually lasts. Symptoms are reduced, or they have half or a quarter of the amount of migraines. Maybe still get a few every month, but they're not getting them every single day. They get their life back. Sorry, I know you asked me specifically for a story, and I can think of my oldest patient. She was 84, and she was actually on a lot of medications for headaches. And one of the medications put her into heart failure. One of the medications made her very dizzy. She had a fall. She was not functioning because of these headaches. And we gave her a migraine treatment. And I saw her at her 2-week follow-up, completely gone. I ended up running into her 4 months later, because if people don't reach out to me, I don't know. I'm like, I guess they're healed. I don't know. Or I guess the medication's still working. And so I ran into her, and she said, I have not had any headaches. Like, it's completely gone. And she said, the only reason I wanted to come back is because I love looking younger. And I love to say to people that really the only side effect is you're going to look refreshed, brighter, well slept.
Perfect. Danika, thank you so much for speaking with me today. I'm Sharon Hughes-Geeky with Doctors of Vernon. Stay tuned tomorrow for another exciting episode. See you soon.
See you soon. Thank you.